Hello everyone, my name is Dr. Aly Hadwani, and I would like to welcome you to this presentation on discussing what high blood pressure is all about. I graduated from Medical University of the Americas in June of 2015. I completed my hospital rotations at various institutions across the United States and Canada. My future goals are to become a family physician that emphasizes preventative strategies, especially within marginalized communities. Before we start, however, the purpose of the seminar is for educational purposes only. It's not used as a modality for individuals to self-treat themselves by the information presented. However, it's used to expand your own knowledge about what high blood pressure is and understand the treatment options available and discuss these issues with your family physician. So let's get into what high blood pressure is all about. High blood pressure is also known as hypertension. And what we'll discuss today are certain statistics of having higher blood pressure in the general population, its definition, signs and symptoms of high blood pressure, also the causes, risk factors, and complications that occur because of having higher blood pressure, as well as how we diagnose and treat these individuals. So certain statistics of high blood pressure. Up to 1/4 of Canadian adults have high blood pressure. Up to 50% are not diagnosed by a family physician. Only 16% are well controlled with the treatment modalities that we have today. Approximately 50% of Canadian adults are hypertensive by the age of 60. And having high blood pressure is the third leading risk factor associated with death. As you can see already, that it's important to raise this awareness of what high blood pressure is, its complications, and how we go about treating it. So a little bit of an introduction to having high blood pressure is that if you look at this bottom blood vessel, which is the normal one, and you can see that the blood flows very smoothly throughout and it has a normal pressure. Of this one that's narrowed, there's some insult that happens to this blood vessel to where it becomes narrowed throughout this area. What happens is that it causes a higher blood pressure because there's a lot of blood that needs to flow through this small tube that we have here, and thus it leads to damage of the blood vessel, leading to further problems and complications as we will discuss in future slides. So hypertension or high blood pressure. As you can see here again, here's a normal tube and you can see the smooth flow of blood throughout it. But what happens with higher blood pressure is that individuals have a thicker blood vessel wall to where the blood flow throughout becomes very condensed in a small space, and which leads to higher pressure within the tube. And we always, if those individuals who do get their blood pressure checked, we always get two numbers, this top number or the systolic pressure, and this bottom number, which is the diastolic pressure. And what I'll do is refer to these numbers as the top number and bottom number. But just to illustrate what the purpose of these numbers are, the top number represents the pressure of the blood in the blood vessels itself when the heart contracts or beats. And the bottom number represents the pressure within the blood vessel when the heart is relaxed. Okay, so just to give you a background of what these numbers indicate. What hypertension is, or high blood pressure, is an increase in pressure. For example, when you're standing on a water hose. So let's take this example into consideration. So let's say this end of the water hose is connected to the house, and this part of the water hose is watering your garden or your plants or the grass. So what happens with higher blood pressure is that there's an insult that happens to the blood vessel itself, in this case the water hose, by somebody standing on it. And what happens before that is that the pressure increases so much here, and over time and time and time it causes damage to the blood vessel, which can also lead to a decreased amount of flow that goes beyond and watering your plants, so your plants are not getting enough water and nutrients, as well as it can expand and expand to explode as well too, or pop open and lead to water spilling out here and no water getting to the plants and garden that is much needed. So similarly as in high blood pressure, there's an insult like the foot standing on the tube, okay, that causes a higher blood pressure. What happens in the blood pressure beforehand is that it increases in size, and it can increase in size to a point to where it bursts. Okay, and it can lead to bleeding in that area. And we'll talk a little bit more about this analogy when we're talking about the complications of having higher blood pressure. So what are the normals of high blood pressure? Less than 120 over 80 is considered normal. Those individuals who have pre-hypertension are those individuals who have blood pressure above 120 over 80, but less than 140 over 90. Individuals who have stage 1 high blood pressure have less than 160 over 100, and above 140 over 90. And as you can see here is that stage 2 is above 160 over 100, and hypertensive urgency, which these individuals need hospitalization usually, are over 210 over 120. And the reason is that their complications risk is very, very high, and the complications can occur very suddenly. But special situations of having high blood pressure normals particularly are for these individuals who are diabetic. So diabetes itself causes damage because of the high blood sugar to the blood vessel itself on the inside, leading to a narrowing of the blood vessel. So having high blood pressure as well as high blood sugar makes an additive effect of increasing your blood pressure. Thus, their blood pressure threshold is much lower than the normal population. So it's of 130 over 80. Over 130 over 80 is considered having to have high blood pressure or hypertension in these individuals. Those who are over 80 years of age, and I would even extend that to a little bit to 60 years of age and above, their blood pressure threshold is over 150 over 90 is deemed as having hypertension. And the reason is that as we age, normally in our blood vessels, they become less compliant or flexible. So the thing is that they become harder as we age. And as it becomes harder, the pressure inside the blood vessels also tend to increase. So, and what's interesting too is that there was a new study done, the SPRINT trial, which looked at all individuals except for diabetics, and they recommended after this trial was completed that perhaps our goal needs to be less than 120 over in the top number, and to decrease that in our normal patients as well, and those who have other complications except for diabetes, as that decreases their complication risk for stroke and heart failure and whatnot to come. But that has not yet been put into practice, and these are our normals of blood pressure are still in play of what our goals are. And as you can see here is that this is an individual with a normal blood vessel that has some slight wear and tear damage, which is normal as we age. This individual here has a little bit more of a thicker blood vessel, and this individual has pre-hypertension. And as you can see, hypertension, it's pretty narrow where the blood flows through. So that would indicate a very high pressure within the blood vessel, leading to further damage. So what are the symptoms of having high blood pressure? Hypertension is known as the silent killer. And the reason is because there's no real symptoms that we know of that an individual can express having high blood pressure. Some may feel a general feeling of unwellness, and certain individuals may have complications of having high blood pressure over a long period of time. They may express some symptoms of these complications, such as vision changes, or having a stroke, or a heart attack, or heart failure. And we'll discuss about what these complications are later on, but usually these individuals would have had high blood pressure for a very prolonged period of time. So that's why it's very important to test these individuals, and every individual actually in the population, of their blood pressure, so that we can ensure that if individuals do have hypertension, they get the treatment that they need. And these individuals who have high blood pressure may be normal individuals, like this individual doesn't look stressed at all, but his blood vessel itself may illustrate someone of this nature. And just as a little joke here, we hope that your doctor is more like this and not like this goofy one right here. So what do you think the causes of high blood pressure are? We've always heard, dietary issues and whatnot, and let's go into what are these causes. So having a high salt diet. The reason is that having a higher salt diet predisposes you to have higher salt in your blood vessels. And within your blood vessels, since it has a higher salt content, the water is drawn out into the blood vessels and creating a higher pressure even within the blood vessel itself. Abdominal obesity. And that's really important because what abdominal obesity is as well, just to illustrate this purpose so that we're all on the same page, is abdominal obesity is basically all the fat basically around the gut area. And the reason that this obesity, this area is particularly important and differs from, say, example, the fat that we have on our bottoms, is that the abdominal obesity is very metabolically active in that it makes certain hormones that increase our risk of having high blood pressure, high blood sugar, high blood cholesterol, and more complications, as we will talk about a little bit later on. So that's why waist circumference is very, very important to try and reduce in patients with high blood pressure and other illnesses as well. Certain medications can actually cause high blood pressure. Certain oral contraceptive pills or birth control pills can cause it. Cocaine, which is an illicit drug, can definitely cause a very high increase in blood pressure. Being on chronic steroids can. Certain pain medications that are even over the counter, like Advil, Aleve, aspirin, or any medication that has ibuprofen, which is the main ingredient in Advil, or naproxen, which is the main ingredient in Aleve. These can also trigger kidney damage that can lead to higher blood pressure. Also, other medications such as decongestants like pseudoephedrine. And I know a story actually that when they had this out on the market, they found individuals who took this medication to have very, very high blood pressures that they were presenting into the emergency departments with strokes. So that's why this is a lot more in our realm of understanding, so that we can prevent that issue with these from taking these drugs. There's also caffeine, which promotes higher blood pressure. Alcohol can as well too. Certain medical conditions can that affect different hormones of the body. Chronic stress and anxiety, which also increase hormones that affect our day-to-day activity, and it can affect our blood pressure. And what's interesting is that high blood pressure may be triggered by even our lifestyle. For example, I went to a conference a couple of weeks ago, and this physician was talking about how an alarm clock can affect our blood pressure. And the reason is that when we're generally sleeping, if you're anything like me, I'm always in a deep stage of sleep while I'm asleep. So getting me to wake up, I need a very loud and annoying alarm clock to do that trick. So when I do turn on my alarm clock, and when it goes off while I'm in a deep sleep, when you're in a deep sleep, you're unaware of your surroundings. So when you hear this loud, annoying, obnoxious alarm clock go off, then a panic comes about your whole body. So your blood pressure increases, your heart starts beating faster. But when you awaken, you see that there's no imminent danger that's happening there. But that also in itself can trigger your blood pressure to be elevated in the mornings. So there's different types of having high blood pressure. There's primary high blood pressure, which is known as essential high blood pressure. About over 90% of individuals who have high blood pressure have this type. We don't really know exactly what causes it. There's many factors that play a role: the nerves in our body, the hormones produced, diet, exercise, whatnot. And then there are secondary causes, which only account for about 10% of cases of having higher blood pressure, such as kidney damage, having hormonal issues or endocrine issues here, damage done to the blood vessels themselves, having sleep apnea. Pregnancy is a big issue as well too, and certain individuals, when they become pregnant, that's the first time that they express having higher blood pressure from testing them. And drugs, as we talked about before. So these are the main causes. We don't really know exactly what. It may be an interplay between all of these issues, such as hormonal issues, nervous system issues, vasoactive substances, and whatnot that alter the blood vessels and can alter our heart and other organs. But what I want to show here is that here's a normal blood vessel that we see here. And with individuals who have high blood pressure, what happens is that damage occurs to this inner layer right here. And when that inner layer is damaged, it gives way for cholesterol and calcium to build up here and cause even narrowing of the blood vessel. So you have all these issues that are playing a role to cause high blood pressure in this person, but now you also have this cholesterol thing over time that has formed here that causes even a higher blood pressure. So as you can see, it's very important to control and understand what individuals have high blood pressure and treat them accordingly. So essential blood pressure, hypertension we talked about, which is having high blood pressure all the time. There's something else called white coat high blood pressure, is that some people get higher blood pressure only when they come to the clinic. So it may be a psychological factor that they see this white coat and this doctor and they get very stressed and nervous and whatnot, that could be attributing to their high blood pressure. But when they take their blood pressure elsewhere, it's normal, in the normal range. Something called masked hypertension is when the blood pressure is high elsewhere when they check it, but it's normal within the clinic. And what may be a cause of this is that certain medications don't last long enough in individuals, leading to that medications tend to wear off closer to the end of the day rather than in the morning. So when you check your blood pressure at night, in the evening time, it tends to be a lot higher. So that may be a cause of masked hypertension as well. So risk factors of having high blood pressure. Having a family history of high blood pressure is one. Abdominal obesity, as we talked about, or which is the fat basically around the gut area, the stomach area. Alcohol use, smoking, having a sedentary lifestyle, which basically means an inactive lifestyle, having chronic stress. High blood pressure tends to affect more men than it does women. It affects more those who are higher than the age of 30 years of age. Our diet can affect our ability to get high blood pressure, of an excess salt diet, for example, excess fat diet, being of African ancestry, and having high blood fat. So what are the complications? Let's go in this diagram first and understand this water hose example before we go into the complications. So this is our water hose again. This is connected to the house. This is connected to water our plants and garden. So let's say, for example, an individual stamps on this blood vessel, or in this case, this water hose, so much so that it completely blocks the flow of water going through. So that means all this grass here is not going to get watered and the garden will die off. Similarly, what can happen is that the blood vessel can be completely closed off, that no blood is getting through and the tissue beyond that area is not getting its nutrients and it dies off. The other way that blood pressure, or that an insult to the blood vessel can cause problems, is that perhaps there is an insult to the blood vessel here to where it just maybe a little bit closes off the blood vessel and causes a little bit of damage there. That can lead to this area being increasing in size and expanding to a point where it just bursts and all this water will be out of the hose, and the water here will not be going to the garden and the garden will die off as well. So similarly in a blood vessel as well, that the blood vessel may be occluded here, or perhaps closed off a little bit, to where it increases in size of a blood vessel so much to where the pressure is so high that it pops and it's bleeding occurs and no blood is going to where it needs to go, to our tissues. So here's some of the complications of having high blood pressure. It can lead to blindness and a whole slew of changes, similarly to tissue dying off, as well as bleeding within the eye. Same thing with the stroke, or a lack of blood flow in the brain, that can lead to the tissue dying off in this mechanism, or of a bleeding nature within the brain. It can lead to dementia. There's something called vascular dementia, which are mini strokes that can happen in the brain that can lead to memory impairment. Also heart attacks, as we'll see in the next slide about how many people have high blood pressure who have their first heart attack. Same thing with heart failure as well too, and kidney damage. Also, having high blood pressure can lead to a complication of having erectile difficulties by causing this thing called peripheral vascular disease. Basically means that it damages the blood vessel to where cholesterol builds up within the blood vessel wall. So we talked a little bit about the complications of having high blood pressure, but I want to focus on these gray boxes here. So under stroke, 77% of people who have a first stroke have high blood pressure. So having high blood pressure increases your stroke risk by 4 to 6 times the normal risk. Almost 70% of people who have their first heart attack have high blood pressure. 3 out of 4 people with heart failure have high blood pressure. And high blood pressure is the second leading cause of kidney failure in populations who have kidney failure. So this is something we definitely need to look out for, and treating these high blood pressure as best as we can. So we talked a little bit about how bleeding can occur in the eye and damage can occur to the tissue because of no blood flow blood flow that's flowing through this particular artery. Okay. So what is a workup that happens in a clinic? So it requires frequent blood pressure monitoring. So usually blood pressure is not diagnosed at one time seeing a high blood pressure. It's done over several times, unless the blood pressure is extremely high to where we diagnose blood pressure, having high blood pressure at that point in time. And it's indicated only in those who are 18 years of age and above to check their blood pressure usually. There's also, the doctor may also do a urine check. They may test their blood for kidney function, how the electrolytes are doing, if there's any sugar, high blood sugar or cholesterol in the blood. They may do checking your electrical activity of the heart via an EKG, and they may do some secondary workup if need be, if they think it's a secondary cause, which are the 10% causes of having high blood pressure, such as those hormonal issues that we talked about or kidney damage. So how should one take their blood pressure? And I think this is very important. So you should definitely, let's start up here. So not to have a conversation while you take your blood pressure, because that also adds superficial numbers to your blood pressure reading. Also putting a cuff on your bare arm. So don't put it over clothing, or don't let it be very tight up here if you have a tight shirt, so that, because that can also add pressure to your reading. Emptying your bladder first is really important, because that can also add pressure to your reading. Having a back support and feet support are very important to not adding extra numbers to the top number in our blood pressure. Keeping your legs uncrossed is important, and also supporting your arm at the heart level. Okay, so you want to keep it supported. If you don't support it, it adds that amount of pressure. Other things as well, that you should also sit down at rest, ideally for 5 minutes, but a few minutes will do the trick before you take your blood pressure. You should avoid any caffeinated beverages at least 30 minutes to an hour before taking your blood pressure. And a lot of doctors mention that this is your home blood pressure monitoring. And I disagree. I think it should be taken at home, yes, but it should also be taken everywhere else too. Perhaps at work, perhaps after praying, or before and after driving. Again, not during driving, because, obviously that'll cause an accident. So avoiding that. Perhaps before eating, before exercising, and all these other issues as well too. So you should take it at different times throughout the day to see if your blood pressure is controlled throughout the day. And maybe there may be a trigger that you illustrate by taking your blood pressure at different times. Perhaps at work, and you're finding it to be very stressful at work, and that's when your blood pressure is being affected the most. So what are the treatments for high blood pressure? First, lifestyle. And if I could write that a million more times, I would, because that's how much I want to emphasize lifestyle being the treatment modality of choice in those who have high blood pressure. Also, medications can help as a second line, and frequent follow-ups and monitoring your blood pressure, whether you're treated with a lifestyle category or medication category, or both. And what's interesting here is weight loss is an important part of the treatment modality for higher blood pressure. And as you can see here, that for weight loss to occur, 80% of weight loss is controlled by diet. only 20% is controlled by exercise. So for those who cannot exercise, for example, those who have injuries to their lower legs, severe arthritis where they can't even walk, 80% of weight loss can be controlled by diet alone. So it's really what we put in our mouth that's what makes us who we are. So it's very important to tackle this dietary approach. So what dietary changes can we make? So there's a specific diet called the DASH diet, which is very, very important. It's actually shown to be the best treatment modality to decrease the blood pressure by the highest amount as opposed to any other dietary and lifestyle changes. Also limiting our sodium intake, increasing moderate intensity exercise, quitting and reducing smoking and drinking, managing our stress in a healthy fashion, and maintaining a healthy body mass index and waist circumference. And we'll talk a little bit about why and what these are in future slides. But let's concentrate on diet. So the DASH diet basically stands for Dietary Approaches to Stop Hypertension. It basically increases whole grains, fruits, vegetables, fiber, and protein, and lowers our fats, salts, red meat, and sweets. It's actually shown to lower the blood pressure on the top number by 16 points on average and the bottom number by 8 points. So pretty significant decrease. It also helps lower cholesterol and the bad cholesterol as well. Individuals should also lower the amount of sodium they take. If an individual is over 50 years of age and has high blood pressure, their limit to the amount of sodium they can take are 1500 milligrams or 1.5 grams per day, or 2/3 of a teaspoon of table salt. And an individual who is not in that category does require about 2300 milligrams or 2.3 grams of salt per day, which is only equivalent to 1 teaspoon of table salt a day. Other sources of salt can include baking soda, soy sauce, MSG, which is called monosodium glutamate. And you can find these actually, what's interesting, in certain Indian spices as well, and mixes. So it's important to look at your ingredients to see if it has this MSG or monosodium glutamate in it, as that also can lead to higher salt intake. Many seasonings have higher salt. Processed foods like certain deli meats, as well as frozen TV dinners and canned foods, can have an enormous amount of salt. There's no current recommendations, though, for increasing potassium, magnesium, and calcium supplements in the diet to promote lowering blood pressure. Some studies show it works, some studies show it doesn't work, but there's no real consensus on it. So as of now, there's no recommendation. So what is the DASH diet? The DASH diet, again, here's your grains, vegetables, and fruits. These are the amount of daily servings an individual would need. And here are examples of servings. 1 slice of whole grain bread is 1 serving of whole grains and grain products. So that means if you're having 7 in a day, now you can only have 6 if you have 1 whole grain bread slice. Similarly for vegetables and fruits. So what's interesting to note is that this DASH diet isn't really unique. It's very similar to the Canadian Food Guide on what to eat for a normal individual. So it's important to keep that in mind and this diet in place so that it decreases blood pressure by the most significant amount. What's also a good tool as well is that 1 serving size is approximately the size of your fist. So if you have a fruit or vegetable that's approximately the size of your fist, that's about 1 serving. Similarly with meat. So incorporating more of a natural approach as well is to increase more antioxidants in your body. So blueberries, cherries, and a slew of other fruits and vegetables can help. Having high B vitamins also help. Avoiding refined foods. I tend to personally recommend avoiding the 4 whites. So white bread, white rice, white sugar, and white potatoes. And including more healthier options like whole grain breads, perhaps quinoa or brown rice. Perhaps cane sugar, or if need be, also honey may do the trick. Instead of potatoes, including more perhaps squash or sweet potatoes in the diet. Using more healthier oils. Also increasing more omega-3 fatty acids, which can be found in salmon, flaxseed, canola oils, as well as certain eggs as well too. The thing about this is that having high amounts of omega-3 fatty acids, there's a side effect of increasing your bleeding risk. And for those who are taking a baby aspirin every day, which also increases your bleeding risk, maybe taking these two in together may not be very ideal. So it's important to talk to your family doctor about that. Coenzyme Q10 can also help. It does tend to have an effect. However, there is a side effect of having too much of this, that it clots your blood. L-arginine is another one that may help, but it has a slew of interactions with certain medications, as well as some medical conditions such as having herpes virus, and it can lead to a lower blood pressure. Other these questionable things also can help blood pressure, but nothing's shown to be proven. Acupuncture is shown to help by basically they put a very fine needle in specific areas of the body that promote stress relief, for example, and lowering of blood pressure. Massage, physiotherapy, and relaxation methods can help, perhaps even meditation. And what's interesting to note, that licorice can actually worsen blood pressure. So to avoid that at all costs for those individuals who do have high blood pressure. So dietary suggestions. Again, limiting the use of salt and foods containing high salt. Increasing the fiber in our diet. It's important, if you increase the fiber in your diet, to also increase the amount of water you take per day. The reason is that the higher fiber, if just taken without the water, it can dehydrate you, as well as lead to a lot of gas, bloating, cramping, diarrhea, or constipation as well. So it's important to take the water with your fiber as well. Choosing more fresh foods and avoiding canned and pre-cooked foods and processed foods. Incorporating other seasonings, for example, lemon or lime, or even garlic or other herbs into cooking versus using salt. And very, very important to read a nutrition label, and we'll go into a short activity now. So reading a nutrition label is very, very important. So you should always start here by looking in this green box. So it says a serving size of half a cup of whatever is in this box, and whatever that servings, that half a cup of item that you eat, these are all the numbers for just a half a cup. In this whole container though, it has 4 servings, so it has 4 times half a cup, which is 2 full cups of this item in this whole box. So if I were to an individual who ate this whole box, I would get 4 times the amount of all these nutrients that are listed here. So it's very important to look at the serving size and how many servings are per a whole container. So checking the calories is important, and you can basically balance these calories with your exercise that you do. Limiting nutrients, these nutrients in orange, total fat, saturated fat. I would also include trans fats, which would be located here as well too. Cholesterol, sodium, and I would also include carbohydrates. For me in particular, and those who are overweight and obese, I would suggest perhaps decreasing the amount of carbohydrates as well. Not completely, but perhaps a little bit more than normal. And also I would include sugars in this orange category as well. The light blue category here of what to get enough of these nutrients are fiber, for example, vitamin A, vitamin C, all these vitamins that are listed below here would be beneficial. Protein is kind of on the borderline. I would say to get the recommended daily amounts, but nothing more than that. And what these percentages tell you are how much percent in a day, if you were to eat half a cup of this or 1 serving of this item, how much percent of a daily value it would be of total fat to get. So this would only be 5%, and sodium would be 13%. And what these percentages mean is that 5% or less is considered low, and 20% or more is considered high. So you want to try to avoid for those bad nutrients, or to limit those orange nutrients by making sure that they're 5% or less, and those that are good nutrients to make sure that they're 20% or higher. Okay, so I hope that makes sense. And let's go through an example here. So you can pause this video. I know you guys are in virtual land. You can pause this video and perhaps discuss amongst yourself or others that are watching as well, what you find good about this nutrition fact, what you find bad, and just have a brief discussion on that. So let's talk a little bit about this nutrition fact. So looking here, this is per whatever this item is it's a serving size. So whatever that one serving size is, these are all the nutrients that are in that one item. Okay, so we look at what's bad first. We notice the calories are enormously high. The fat percentages values are extremely high saturated fat, high cholesterol, high sodium, high carbohydrate as well too, one can argue. Even the protein is pretty high in this. So you're getting excessive amounts of these nutrients that you should watch out for. What's good about this is that there's no trans fats. That's really good. The dietary fiber is extremely high, which is very good. Sugars are relatively low, and these nutrients are really good, that they have high percentages there. What I would like to mention is to look at more closely at the sodium, as we talked about. So we mentioned that those who are over the age of 50 and have high blood pressure, the limit for those individuals in a day is to have only 1,500 milligrams of sodium per day. They've already, if that person were to eat this, they've already increased, went well above and beyond that 1,500 milligram limit of sodium. A normal individual, however, can get up to 2,300 milligrams of sodium. So they're pretty close to their maximum of about 85% of the total sodium in this one item encompasses the sodium, 85% of what they should be having of sodium in a day. So I'll just give you a hint about where what this place is, and you can just guess. It's a burrito place, and it's a fast food place as well. So any ideas? Okay, let's find out where this place is. This is a Chipotle chicken burrito, and I've gotten this from their website. I entered in flour tortilla, chicken, white rice, fresh tomato salsa, romaine lettuce, cheese, sour cream, and black beans. So this is just something here to illustrate that just because a place may look that it's very healthy, may not necessarily be very healthy, and we should always look at the nutrition facts and the ingredients of everything that we eat, whether it be fast food or things that are made at home, and the ingredients that we use in our cooking. Exercise is very important. To get 30 to 60 minutes, 4 to 7 times a week of moderate intensity. Higher intensity is not more effective and can actually be more damaging if it's too high intensity all of a sudden. Examples of moderate activity can include brisk walking, bicycling, dancing, aerobics. Basically something that increases your heart a little bit. You notice you're breathing a little bit heavier, you're sweating perhaps a little bit. And those are the indications that you're doing a moderate intensity exercise. And regular exercise, as we see here, can decrease our blood pressure 5 points in the top number, 4 points in the bottom number. And for every 10 pounds that are lost, there's a decrease in blood pressure of approximately 4 points in the top number, and on average 3 points in the bottom, up to 3 points in the bottom number. So that, with the diet, can basically very well control our blood pressure. So let's talk about body mass index and waist circumference. So body mass index is basically a measure of obesity. And what the calculation requires is the weight in kilograms over the height in meters squared. So we have an example here of an individual who is 90 kilograms and is 1.65 meters tall. So we take 90 divided by 1.65 times 1.65, and we get 33.05. And if you look here, this individual lands within the obesity class 1 range. The more obese you are, the higher risk you have of obesity and its complications, which we will discuss on the next slide. We'll also discuss waist circumference on the next slide as well. The World Health Organization also does say that the body mass index is a good measure of obesity, except for those individuals who have a lot of muscle mass, who are very muscular and go to the gym a lot, as well as those individuals who are pregnant. So metabolic syndrome is basically, if you have 2 out of 4 of these criteria, you have a very, very high risk of having these complications of obesity. So these are all the complications here. So let's go into the criteria for the syndrome. One is waist circumference, more than 40 inches in men and more than 35 inches in women. So that's one criteria. Having high blood pressure is another criteria. Having type 2 diabetes or high blood sugar is another criteria. Having high blood fat is the last criteria. So having 2 out of 4 of these predispose your risk of having all of these illnesses are very high. So certain complications can be sleep apnea, which is very common, gallbladder disease, arthritis, stroke, heart disease, having a slew of cancers. So it's very important that we control our weight in terms of these complications here. And here, losing just 15 to 20 pounds, however, can reduce the risk of serious complications such as high blood sugar, high blood pressure, and heart issues by 10 to 25%. So that's very, very high. And just by losing that amount of weight, it's very important to decrease the risk of all of these issues here, as well as lower the waist circumference. So medications in treatment for high blood pressure, I won't go into the medications here because it's more of an individualized approach with your family practitioner. What I would like to mention though is that we want to make sure that the blood pressure doesn't go too low in those individuals who are elderly, because they may be already at a fall risk. For example, if those individuals who have severe arthritis in their knees, legs, even the hip. So we want to make sure that their blood pressure doesn't get too low to lead them to a fall. So it's important to follow up with your family practitioner, especially if you're undergoing lifestyle changes with your family practitioner. It's important to follow up every 3 to 6 months. If medications are right for you from your family medicine doctor, it's important to follow up every 1 to 2 months until your blood pressure is controlled under target for 2 visits in a row. And once your blood pressure is at target, however, the family doctor may ask you to follow up every 3 to 6 months to make sure the blood pressure is under control. The family doctor may seem that lifestyle and medications are not working, and they may do a referral to somebody, to a specialist, to diagnose if there's any other causes for your high blood pressure, which may be secondary in nature. So maybe a hormonal issue or kidney damage or etc. And again, hospitalization if you have hypertensive urgency or blood pressure more than 210/120. So let's summarize. High blood pressure is a silent killer. There's no really symptoms that we feel of having high blood pressure. A healthy diet and exercise are the best ways to treat and prevent high blood pressure. In addition to that, stroke, diabetes, high blood cholesterol, and more. It's important to monitor and control our blood pressure regularly. In addition as well, controlling diabetes and cholesterol regularly, and to follow up every 3 to 6 months with our family practitioner. So I hope this seminar has been of help to you. Here are my references of where I got a lot of my pictures from, as well as my information. Okay, and I would just like to say thank you. And if you have enjoyed this video, please like my video below, as well as subscribe to my channel, and I will be increasing more videos in the near future. What I would also like to mention is that if you watch this video, I would highly recommend to watch the stroke video right after this, as it has a lot of similar pictures of the water hose example to illustrate what strokes are. And I thank you once again, and I wish you a great day.